and people are still joining in. So once again, a warm welcome to everyone to the training program. Um, so purpose of this training program is to get introduced to what is CPHQ uh, training and certification. And apart from that, I would like to also inform you about a little bit about the overview of the syllabus, what you have to uh, study, and then because this is more like an introduction program, but yeah, if possible, I will try to do some question and answers as well towards the end. I will also show some case studies where like CPHQ tools and techniques which you learn, like PDSA, Lean, Six Sigma, while you learn about healthcare quality and population uh, plus data analysis, if how you can apply it to improve the processes of your hospitals. So once again, welcome to everyone for this training. And we are yeah, so let me do a formal welcome to you, formal welcome before people are still joining in. So let me, uh, yeah, so as the people are joining in, I will just spend around 5 minutes to introduce about the organization, about myself. I think that will give the people to, uh, enough time to set up the things. We'll talk about the benefits of what is CPHQ if you appear for a CPHQ examination, how it is going to benefit you. Then we'll also learn about the modules. What are the different modules? The 7 modules of CPHQ, 7 lessons you need to learn when you want to appear for a CPHQ examination, what exactly you have to study. And then after that, I will take some of the most difficult topic, the reason, and in fact 56, I don't say 56%, to be very precise, of the questions are related to data analytics, and people find it very difficult. So that part I will try to cover today. And most of the cases, most of the uh, people, they tell us that when they attend our training program, CPHQ training program, they were able to pass the examination because they were very, very thorough in the data analytics. Because the other part is relatively simple. But nevertheless, I'll try to cover some other parts as well. I'll show you some projects from the hospitals, what healthcare quality professionals have, how they have applied these tools and techniques, and how they have improved the quality, saved the costs of the hospitals for the hospitals, and also improved the patient safety. About the organization, we have been around for quite some time, 20 years, and we have trained more than 150,000 professionals around the world, which includes CPHQ, Lean, Six Sigma, quality, in almost all the fields, data analytics, AI. Just to give you a little bit of confidence, I have clicked some photographs of me conducting the training program. And if you are joining the CPHQ course from our organization, and you are going to register today or tomorrow, I'll be your trainer. Yeah, but we have been, as I said, these are some of my training programs around the world. I also take pride in telling that I conducted the first ever Lean and Six Sigma Black Belt training program in whole of Middle East. And incidentally, that was for a hospital. That was for King Khalid Eye Specialist Hospital. But after that, I implemented the data analytics, healthcare data analytics, Lean, Six Sigma, and also conducted CPHQ training programs of King Fahd Medical City, International Medical Center, KSUMC, and many, many colleges, medical colleges, Dammam University, and then after that, Sultan Qaboos University Medical Hospital, Cleveland's Clinic, and even I have consulted and been part of the JCI implementation. And so these are some of the photographs just to prove that, we have done training programs worldwide. I've also consulted National Healthcare Service in UK for their quality journey, for their application of data analysis to reduce their infection rates and improve the patient safety, and also reduce the cycle times. I had done this through implementation of Lean and Six Sigma. So here is one person talking about our implementation about Lean, about quality tools and techniques in National Healthcare Service in UK.
Well, we have Alex with us, and he has done excellent Lean and Six
Oh,
Sigma
sorry.
projects
Are you
in
able to
National
hear?
Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvement at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Yes.
I hope you are able to hear whatever was being said. Just let me know. Just can you please confirm that you are able to hear? No, sorry, just a minute. So I think I'm not able to. Okay, fine. Okay, great. Okay, so again, one more. Mr. Andrew Robertson with us, who's the CEO of King Edward VII Hospital in London, and we would like to know from Andrew that what does quality mean to you?
Well, quality means excellence, really. In many ways, it means obviously excellent patient care, which is paramount in a hospital. It means excellence of.
Okay, so yeah, just to tell you that we have an American Society of Quality. I've spoken multiple times. Last year, I had spoken about how to reduce the nosocomial infection using data analytics and healthcare quality. And, uh, our health ministers of Saudi Arabia, Dr. Muhammad Abdul Ali and Dr. Tarif Alama, they have been our they have attended our sessions, and they have also benefited from our certificates. We have Dr. Tarif Alama with us. And we have got lots of credentials. So I think now enough people have joined in. So I will just finish the. Let us let us proceed. And um, before that, let me ask you certain questions. So can my team start the polls? So are you currently working in the healthcare field? So just wanted to ask you first. Even though you're not working, you can still appear for CPHQ, but yeah, it will help. Then it will help you to make a career in healthcare. So most of you are working. Okay, fine. Thanks for that. Can we go to the next question, please? So are you currently preparing for the CPHQ examination right now? So I see some of you are preparing. So this is definitely going to help you. So because I see many of you are preparing for that, maybe I'll try to give you very specific knowledge also related to, as I was telling, the data analytics appears to be the biggest hurdle in passing the examination. So I will try to give some information and knowledge related to that. And a lot of people are telling that they're planning in the future. So thanks for that. Do we have any other questions? And what is your role in your organization right now? So accordingly, I will give my examples. So I see many of you are nurses, and some of you are physicians, and people from administration also are there, and lab also. Some people are from lab as well. Pharmacy also, some people are there. Okay, thanks for that. Okay, so okay, are there any other questions, please? Okay, so tell me what is your biggest challenge, and based on that, I would tailor make my training. So I'll try to give the example related to, so a CPHQ, certified professional in healthcare quality, he or she is able to solve the organization's problems. So you can solve the problem of lack of staff, time constraints, reduced cycle times, and data collection, data analysis, also resistance to change from, yeah, so we do. There is a full chapter of how to manage the resistance to change management, that also you learn. Today, of course, I'll not be talking about it. If you want, towards the end, maybe, because a lot of people are talking about it, I will try to cover that as well. So my team can remind me that. It's very, very important for me to remember that. So change management. So I will definitely talk about that. And okay. Thank you for answering these questions. And if there are any few more questions, please go ahead with that. Okay, great. And so thanks for your inputs. And I've just made certain changes as you were giving the inputs. I just made a few changes in the slide, and also have tried to tailor-made this program. Okay, so CPHQ is an exam conducted by NAHQ, and if you get you pass through that, pass through the examination, then you will be certified as a CPHQ. By the way, if you attend our training program, like if you just attend our training program, you will get the certificate as certified healthcare quality expert. So by attending the program, it enables you, because we'll be doing some question answers there also. And this will get you a certificate, of course, after attending our, not this 2 hours program, but the full-fledged CPHQ preparation training program. After that, you can appear for the exam with confidence, because our passing percentage is 90% plus. It's very, very high, and it is acknowledged by multiple hospitals in around the world. So I would like to as well, share some of our knowledge with you. And so there are lots of modules like organization leadership, healthcare data analytics, performance and process improvement, patient safety, etc. And I will tell you about them very briefly in a short while. Those who are already preparing for the exam, they're aware of it, but I would take you through those 7 modules very, very briefly in the beginning. And then after that, I will expand on the data analytics module a little bit more. Why you should earn a CPHQ? Because it really adds on to your career, and around 30 to 40% increase in salary is observed if you are CPHQ certified. It is sometimes a mandatory certification for some of the job roles in the healthcare. So 23% recall questions are there, so 57% application questions, which we prepare you in our CPHQ preparation course. We prepare you well for that. And 20% is related to analysis. There are 140 questions. Out of this, 15 questions are pre-test questions, means they're not going to score you on those questions. So 125 of these questions are used in computing the score. What does it mean? It means that 15 questions will be interspersed in your 140 questions, But these 15 questions are just pre-test question, means they are not going to score you. They've just included them to see how people are responding to those questions, so that these 15 questions can be included in next examinations, forthcoming examinations. So don't spend too much time, not more than 1.5 minutes on each question. So you have got only 1.5 minutes to answer the questions. So it's very, very less time. And that is why you need to prepare really well. And that's what our course intends you to prepare. We intend you to fully prepare you so that you are confidently able to appear for the exam and also pass the examination. The exam is for 3 hours, and it's a multiple choice question giving 4 options, and you have to choose the right options. I'll not go into the too much of details of what CPHQ examination is, but let me tell you about the modules. So there are, I told you, there are 7 modules: quality leadership and integration, quality review and accountability, patient safety, regulatory and accreditation, performance and process improvement, and healthcare data analytics, and population health and care transitions. So these are the 7 modules, and let me, very, very briefly, I'll take you through those, and I will expand upon the most important modules today, which is the data analysis and process improvement. However, I'll still speak about the strategy a little bit, and also I'll speak about towards the end. I'll try to remember myself, to remind myself towards the end a little bit of a change management, because many of you are telling that change management is the big issue in many of your hospitals. So I'll talk about that as well. Okay, so now let me first dwell upon the first module, quality leadership and integration. So as a certified professional in healthcare quality, you are supposed to advise the senior leadership to integrate the quality in your strategic objectives. Every hospital has got, every healthcare institute, every lab has got a vision. Vision means how they would like to see themselves after a certain period of time. Like, for example, 2030, my hospital has a vision to become the best pediatric hospital in the city. I was advising Cedar Hospital once. They wanted to become the best pediatric hospital in the country or a city. In that case, that is the vision. Vision means something what you would like to see yourself, how you would like to see yourself at the end of a particular time period. So 2030, it is usually associated with some time. So you have a vision, and once you have got the vision, you would like that vision to be accomplished. So you will create some strategies, isn't it? You will create some strategies to achieve your vision. So you want to become a #1 hospital, let's say. You want to become #1 hospital. Once you want to become #1 hospital, obviously you have to do something about it. So you have got lots of ways to become #1 hospital. You can create strategies. You can hire the best people. You can get the best equipment. You can get the number of people, most number of the patients. Or some hospitals have a strategy of focusing on few patients, but only the complicated cases. Some hospitals focus on the technology. It depends on your strategy. You decide about your strategy. And once you have decided the strategy, don't forget the safety and the quality. So how would you integrate, how to inspire the leadership to integrate the quality in the strategic business objectives of the organization? That's what a certified professional in healthcare quality does. For that, he or she has to engage the stakeholders also. So you will learn about that as well. Then you have to also learn about stakeholder engagement, how to ensure that they support you. That is about the first module, or first module, which talks about quality leadership and integration. Okay, so that is one. The second one is quality review and accountability. So here you learn clinical practice guidelines, pathways and outcomes, quality-based payment programs, practitioner performance evaluation, patient experience, identification of reportable events for accreditation and regulatory bodies. You will also learn about maintaining the confidentiality and also implementing and evaluating the quality initiatives that impact the reimbursements. So most of the countries have a have a system in place where they support the healthcare with appropriate funds. So how to ensure the funding and what kinds of funds are available and how to maintain the quality of our organization so that we can keep receiving the funds from the government or from the insurance companies. So that's what the quality review and accountability is about. 16 questions are asked from this module. 19 questions are asked from the previous module, which I just was describing, quality leadership and integration. The next module is about patient safety, which has got 18 questions. Here you learn a lot of tools and techniques also, like how to prevent these safety incidents. You learn a tool called FMEA, failure modes and effects analysis. Today in the session, I will not be covering the FMEA, but I strongly recommend that you please watch my video of failure modes and effects analysis, and you will learn FMEA in total, in full. And this video has been watched by more than 1.7 million people around the world. I strongly recommend that you please watch this video, because today I don't have enough time. This is more like an interaction. This is more like giving you the bigger picture, bigger overview of what is CPHQ, and maybe in details about some of the tools and techniques, but we can't take you through the whole all the topics. But this topic, FMEA, failure modes and effects analysis, is something very, very important. And many of you might be using it as well. So I'll give you that link here in the chat box, and please do watch. FMEA is one tool to ensure the patient safety in our healthcare institutions. And apart from that, we also learn about how to facilitate the ongoing evaluation of safety activities, applying techniques to enhance the culture of safety within the organization, etc. Then you have got regulatory and accreditation. Regulatory and accreditation, around 8 questions are asked. Pretty simple, easy. I don't see anyone failing in this. We also analyze. We have got enough database, or we have got, by the way, we are proud to tell you that in the past 10 years, more than, I think, or 13 years to be very precise, 13 years, more than 4,500 CPHQ professionals have been certified through our institutions. Also, one more thing, a CPHQ professional is a floating population. Floating population means at a given point of time, around 16 to 18,000 people are there as certified CPHQ professionals, because every 2 years you have to renew. So some people don't renew the membership. It's not mandatory that you have to renew, but because if you are a CPHQ professional once, generally you are treated as a CPHQ professionals forever. So you don't have to renew it. So if you don't renew, obviously the CPHQ, you're not counted in the CPHQ population, floating population. But yeah, that certificate is valid always. So given point of time, 19,000 approximately, 18 to 19,000 are there. It is floating population. But in total, around 45,000 professionals have been certified around the world. And we have contributed to 10% of it. 10%. It's a very big number. People from US, people from Europe, people from Middle East, people from Australia, people from India and Indian subcontinent. Everyone, around the world, they attend our sessions, and they have really, we are proud of this achievement. So regulatory and accreditation, there are 8 questions. How to ensure that your hospital is accredited, how to choose the right accreditation for you. Some accreditations are mandatory. Accreditation and certification are a little different. Accreditation is for the hospital, for the institute, for the organization, and certification is for the individuals. Like you get certified as a CPHQ professional, but you get accredited by the JCI or SIBAI. Then we also learn about performance and process improvement. So today I will be expanding upon that. And why? Because 27 questions are there. So process, performance and process improvement and health data analytics, 26 questions and 27 questions. So you can imagine around more than 50 or 53 questions are from these two modules. So today I'll be expanding upon that. I'll be taking some of the topics from these modules. Here we learn the basic statistics. We learn about how to improve the processes, how to do improvement projects in our healthcare environment, and also how to improve the patient satisfaction. So here you learn about Lean, PDSA, Six Sigma, and also tools and techniques like fishbone diagram, FMEA, process map, etc. FMEA, I would request my team to give a link here, because that will be a great value add for you. Please do watch this FMEA link, FMEA later on. In fact, this program, I would have loved to keep it for 2.5 hours, and half an hour I would have shown you some case studies, and also I would have taught you FMEA as well. So, but yeah, nevertheless, you can always go and see the video. So this FMEA analysis video is given here in the chat box. Please do store that link, and please watch that. I strongly recommend. And in fact, you can apply the FMEA immediately to any of your pressing problems in your hospital or the clinic. You can do that immediately. And if you need any help, I'll be happy to help. I also conduct the training programs in-house. So if your hospital needs a training for, let's say, a group of 5, 7, 10, 20 people, I would be happy to conduct these training programs. And in case that is the requirement, you can always connect with me. Okay, now these are the tools and techniques, and I will take you through the whole process of doing a project, and some of the tools and techniques in the whole journey I will be teaching you. Then we have got healthcare data analytics. We'll understand about measures, the types of measures, and also we'll learn about different ways of handling the different types of data, and why measurement is important, because you can't improve if you cannot measure. So some of the things like average, I don't think we have a lot of time to talk about, say, standard deviation. If time permits, I'll even talk about that. The correlation, we'll learn about a little bit of that, and control charts also. And so these were the modules up to 6. And the 7th module has been introduced in the year 2023, which is population health and care transitions. So as a CPHQ, as a certified professional in healthcare quality, you are not only helping your hospital to reduce the costs, but also you are helping the government to reduce the healthcare costs. So how you can do that? And this lesson or this module is all about that. So here you identify the population health management strategies to integrate into the improvement initiatives, and in a way you will help the government to reduce the healthcare costs incurred by the government. That also is introduced as a new module, and you have got 11 questions being asked from that. So let me cover briefly organizational leadership. Maybe I'll talk very, very briefly, maybe not more than 5 minutes, 5 or 7, 10 minutes about it. After that, I will jump to the data analytics part and process improvement part, which gives you around 54 questions in the examination. And I'll teach you some certain tools also. And I'll be demonstrating some of the tools. Because of the lack of time, I will do it. I can use Excel sheet, or I can use some softwares, which I give it to you whenever you join our sessions. We'll be giving it to you, and we give a very detailed training about each of these tools and techniques, and plus along with all the softwares and also books, the relevant books also. By the way, let me tell you, the training material which we have developed when we do the training program, or regular training program, the training material which we have developed is coming from the NAHQ means it is perfectly aligned to NAHQ, which is the certifying body, which is the body which conducts the examination. So chapter by chapter, and we have applied the Pareto principle. Pareto principle, I'm not sure how many of you are aware of Pareto principle. Just let me know. Are you aware of Pareto principle? 80-20 rule? Just write yes or no. Okay, many of you are not aware. Okay, many of you are not aware. No problems. I'll talk about that also. Not worry. So, okay, let me let me tell you about what is Pareto very quickly. See, Vilfredo Pareto was an Italian economist. Yeah. Vilfredo Pareto was an Italian economist who found that 80%. Okay. Okay, let us learn. Let us start with that. Although I would later on use Pareto in the proper sequence while we are doing a project, but let us start with the Pareto. Why not? Because this is more like an introductory program, so I'll maybe pull out some tools and techniques in detail. So let us do a Pareto. Pareto. So what is a Pareto? Pareto principle. Pareto, Italian. It is there was an Italian economist by the name of Vilfredo Pareto who found that 80% of the money or wealth or the land in Italy was with 20% of the people. He called this as 80-20 rule. 80-20 rule or principle. Then he also found that 80% of the production of the crops in Italy, it was again could be attributed to 20% of the total costs. Now, in healthcare perspective, I can say 80% of your patients are being treated for 20% of the diseases. So suppose you are treating 100 diseases, only 20 diseases, and suppose there are 1,000 patients coming to you, 800 patients are being treated for these 20 diseases. And the remaining 80 diseases, are so 200 patients are just for 80 of these diseases. So total 100 diseases suppose we are treating, so 20 diseases, you'll find 800 patients always complaining about these 20 issues. So this is 80-20 rule. The same thing is true in quality also. 80% of your problems, whatever you are facing in your hospital, they are due to 20% of causes. I will apply this 80-20 rule when I do the project. Okay, so I'll take you through a project. While doing through the project, I will apply this 80-20 rule, and you'll learn this in a better way. But let us first understand one. I'll just take one topic in take one topic in organizational leadership, and that is systemic thinking. So, as a quality professional, you should have a systems thinking, not silo thinking. What do you mean by systems thinking, and what do you mean by silo thinking? Let me give an example. And please ask questions, keep asking questions if you're not understanding anything. Thanks, Amarjeet, Rahma, Anjum, Dr. Saif, Sadia, and everyone who's participating. Sija, so thanks for interaction. So I keep getting an idea that Rafia is there, Jinju is there, Nikhat. Yeah, so thanks for that. Although I may not be able to take your names every time, but it will give me a little bit of moral boosting if you keep interacting and responding, so that I feel that some people are out there who are sitting there and interacting. So great, thanks for that. Thanks for that, Asiya. Thank you. And yeah, so let us now. What I will do is I will make a model of all the organizations in the world. No, it could be a hospital, it could be a lab, it could be a clinic, it could be a university, medical college, whatever. All the organizations in the world, how they look like. So as a quality professional, you have to think like that. So here you have got, let's say, think of your hospital or your clinic or your lab or whichever institute you belong to. So just to for the ease of my training, I would say think of a hospital. Your hospital takes certain inputs. There are certain inputs through a series of steps A, B, C, D. We create an output. These outputs are either product or service. Products or service. Okay. Say, for example, one of the service which we provide is treatment, treating a patient, right? So the inputs could be the patient, the information about the patient, the nurses, the doctors, the facilities, the lab equipment, the X-ray equipment, everything, radiologic equipment, everything included, everything together, that becomes an input. And when the patient passes through a series of steps, the output is the treatment. The output is received by the customer. Customer here is the patient. In my example right now is the patient. Similarly, customers could be your shareholders of the hospitals also. They could be also your customers. And so on and so forth. Sometimes the government can be a customer. Yeah. I hope you are able to imagine that part. Sometimes the government is your customer. Especially if you are a government hospital, then definitely government is your customer. And if you are not, still healthcare is a highly regulated area. So even then also government is the customer. Okay, I hope you are able to visualize this. If not, just let me know and please ask questions. Feel free to ask questions. I am there to answer your questions. Okay. Now, there's a team which listens to the feedback of the customers. And what I'm doing here is, again, I'm repeating those who have joined a little late, I'm drawing a model, I'm creating a model for all the organizations in the world. So you receive a feedback and also you predict the demand of your, demand of the diseases. Sometimes, how sometimes you have to predict the demand. Government will always tell you that now this pandemic is coming or some typical seasonal issues are, to be handled. So that, will be analyzed by a strategy team or governing board, planning team. And they will advise the suppliers. They would advise the suppliers to give the related inputs because they have predicted the demand, and also based on the feedback, they would also inform the departments A, B, C, D to change the standard operating procedures and also the parameters of the process. Sometimes the clinical pathways, and to change the way of treatments. This is how every system operates in the world. Every organization operates in the world. This is how every organization in the world operates. Okay. Now, if you think in terms of the system, you are a part of a system. You are a part of the system. We call it a systemic thinking. Systemic thinking. Think about the whole, not the parts. This also is known as value stream map. You will learn a lot of jargons today. You will learn a lot of tools and techniques. You will learn a lot of jargons today. Value stream map, also known as value stream map. So as a healthcare quality professional, you should look at the system, not the department, not the silo approach. Silo approach means like I belong to department B. I come in the morning at 9 a.m. I go home at 5 p.m. and I've given some jobs, say 50 jobs to accomplish, and I do that job, I follow the steps, and I'm happy. I don't care what's happening in A, I don't care what's happening in C. That is known as silo thinking. Silo means I am operating in my own silo. I don't care what's happening, what's going around. That's known as silo thinking. So don't have silo thinking. You have to have systemic thinking. That is what systems thinking is. That's how, as a leadership, see, you are an advisor to the leadership. You are the internal consultant to the leadership. So as a certified professional, healthcare quality professional, people look up to you to give the right advice. And to give the right advice, you have to have systemic thinking. There's a lot of applications of this. Maybe one simple example I'll take. Say, for example, you are taking 10 minutes here. I'm just taking a very simple example. Your job, you complete job A in 10 minutes. Okay. Job B in 10 minutes. Job C in 10 minutes, and 10 minutes, and 10 minutes. And your patient flow is also every 10 minutes, one patient is coming. I'm just taking a simple example. Please understand. See, what is the difference of having a systemic thing? Okay. Let's say 6 patients are arriving. 6 is a very less, but let us assume 6 patients are arriving per hour. So every 10 minutes, one patient is arriving. Now, if I am completing all my jobs in 10 minutes, you'll find as soon as the patient enters, he keeps moving. There is no waiting time. I hope you are able to visualize. There is no waiting time. Like first patient comes, he completes whatever that workstation. It could be triage, it could be registration, whatever. Every step is happening in 10 minutes. So every patient, he will go out of the system in 40 minutes. But he is doing something, he is worked upon. The patient is being handled. He's not waiting. But what happens if B takes 20 minutes? What happens if B takes 20 minutes? There will be a queue. There will be a waiting time. You'll find people are waiting in front of that workstation. Right? This waiting time is a waste. We call it as a waste. Waiting time, queue, it's a waste. You'll find that C is idle. C is waiting for B to complete the job. So what I will do, I will improve B. This is known as theory of constraint. I will improve B. I'll not focus on C or D. Otherwise, a department manager of D, he attends some conference and he says, wow, it's a very good thing. Let me automate my process. And what he does, like say C, department manager C goes and automates his process. And instead of 10 minutes, he starts doing it in 2 minutes. But is it going to help the patient? Is it going to help the hospital? No. The patient will start waiting more. You will have a long queue here. I hope you are able to understand. It is a waste of our money to invest in making C from 10 minutes to 2 minutes, rather than you should focus on B and automate that process, make 20 minutes to 10 minutes. And if you cannot do that, then at least have 2 workstations, like 2 nurses or 2 doctors or 2 whatever that workstation is, have 2 of them so that there is no waiting time. It is so easy. So see, once you understand the things, we have reduced the waiting time in multiple hospitals, many hospitals, Cleveland Clinic. Then we have got my team can help naming the International Medical Center, Dr. Sulman Habib. We have got Burjil Hospital. So many of them. So many hospitals we have done around the world. We have helped. Of course, because I think most of you from today, I'm conducting the session for Middle East, so I'll take examples of hospitals from Middle East. But we have done a lot of good work in US as well, and we have done a lot of work in UK as well. Australia, I'm a permanent resident of Australia, and but yeah, most of the time I'm in Middle East because most of my clients are in Middle East, and including our health. I'm also the advisor, the data analytics advisor and process excellence advisor to the health minister of Saudi Arabia. So obviously, most of the time I'm there, but but I keep roaming around. So now this was about the systems thinking. So first you should have systems thinking. Now, if you have systems thinking, you can reduce a lot of waste in your hospital. So let me tell you what is waste. Let us understand the waste in our hospital. Waste is not that waste which you throw in the dustbin. Okay. Okay. I'm not. I'm skipping this 5 levels of leadership because I'll rather spend time on the today. I'll spend time on the maybe tools and techniques, the important part. So let me tell you about what typically the waste means in the hospital. So we'll start with that. Then I'll tell you how to do a project. So we have high volumes, high variety, high variability, high speed. See, we have to break down the complex problem into simple problems. Hospital is a complex system. It's not a simple system. It's a complex system. Because see, every time just following you, it's not a factory. In a factory, you follow certain steps, you get a desired expected output always. But here, there's a lot of variation. So this leads to service breakdown, wasteful processes, and medical errors. I'm going to talk right now about wasteful processes. So what is lean? So lean is one module in your CPHQ syllabus as well. So I'll just cover very, very briefly about it. There are 7 wastes: waste of intelligence, waste of defects, waste of waiting, waste of inventory, waste of motion, waste of transportation, waste of overproduction, waste of overprocessing. I'll give you some examples. Because much of the waste is hidden waste. We see some of the obvious wastes very easily, but most of the waste is hidden wastes. Yeah, these are all wastes. How to reduce the wastes, the hidden waste especially. Let me take an example. If I draw the simple steps of blood test processing time, what happens is, see, first let us understand what is waste and what is value added. There are 2 types of activities: value added activities and non-value added activities. Value added activities are those activities which the customer is willing to pay for, which the customer is interested in. The customer finds the value, the patient finds the value. Patient says, yes, I'm fine with it. It's adding some value to me. But non-value added activities or the waste are which the patient says, sorry, why you are telling me to do this? I don't want to do this. It is not adding any value. So when the patient comes to the hospital, he is looking for a value of, what is the value he's looking for? Is enhanced health, better health. That is the value. Now, if you tell him to walk to the OPD, walking is a waste. Registration is not adding any value. It is a waste. Walk to the lab is a waste. So any waiting is a waste. So if you see, only 2 steps are adding value from patient's perspective. Now you may say that you have to register. That is my process. That's your process. But for the patient, it is not a value addition. He wants to know the health status, and that is why he'll not be interested. If you skip this process, he'll be happy. If you don't make him walk to the OPD, he'll be happy. If you don't make him register, he will be happy. And we have removed sometimes even the registration processes in many hospitals. So some of the examples I'll try to show you. Like one Asian hospital determined that 80% of the nurse calls from inpatients were housekeeping in nature. Means the times of the nurses was wasted because the patients were calling, my say pillow cover is dirty, I want to replace my towel, my bed sheet is having an issue. Now this is not nurse's job, but it was, in fact, when we did a Gemba investigation. Gemba means go to the field, go to the place of action. And when you do a Gemba walk, Gemba means Gemba, I'll just write it down. Gemba, Gemba, Gemba. I don't want to go to the whiteboard right now. So Gemba walk means, in Japanese, Gemba means workplace. To go to the workplace and identify what exactly is happening. And we found that lots of calls were housekeeping in nature. And many of them are little bed sheets, etc. This is waste of intelligence of nurse. nurse will forget to give you the medicine if you, if you engage the nurse. So you have to have a proper system in place, and you have to educate the patient also. It depends. And what we did, we just educated the patient and made the whole difference. Similarly, I'll just take one more. Yeah, this one is okay. We doubled the cardiology lab capacity from 8 to 16. So the cardiology program was adding 2 more cardiologists, and the outpatient cardiac diagnostic lab had a capacity of only 8 exams per day. So we redesigned the work using those 2 techniques which you learn in CPHQ, and in a single day you could see 16 patients. Similarly, if we could reduce the diagnosis to exam time from 2,700 minutes to 64 minutes. Similarly, we cut down the admission from 17 minutes to 5 minutes. We reduce the signatures. Approvals are a big waste. Approval are a big waste. These are all good case studies which we have published in various newspapers, articles. I myself presented in many NHQ conferences and American Society of Quality World conferences. Those who joined little late, I did show some photographs making me presentation in different conferences also. And more, if you want to know about it, they are all available on my YouTube channel. Also, we have an Anexas YouTube channel also. You can subscribe to Anexas YouTube channel. You can get detailed modules, YouTube modules of all the CPHQ related work, and also anything related to quality. It's a one-stop for you. You can always learn about all the tools which are used in healthcare to improve the processes. Now, again, idea is to reduce the waste as much as possible and create value. So this is the typical patient flow. I'm not going to the details because almost everyone is aware of that. And so we identify which is value added, which is non-value added. Like walking is non-value added, right? So what we do is let me give some examples of waste. Waste is unnecessary process, motion, unnecessary waiting, unnecessary transportation, errors, and any person who's underutilized is a waste. Any person who's overutilized is also a waste. Please remember, underutilization of a person or an equipment is a waste. You have got an X-ray machine, you're not using it. You have got that robotic surgery equipment, but you are not using it. It's a waste. If you are overusing, that's a waste. Again, similarly, if you are making your nurses work for multiple shifts again and again, that's a waste, because overburden will lead to errors. So any equipment underutilized is a waste. Any person, any employee underutilized is also a waste. So cost of 5-minute MD walk on a lighter vein is there, or a walk to elevator is 1 minute, elevator wait is 3 minutes, elevator travel in 1 minute, walk to lab or pharmacy in 1 minute. So if you do a Gemba investigation, you will find that, hospital is losing. And in fact, we did this study in a US hospital, and these articles are also published. I have published these articles in multiple US journals also, and also in Saudi Arabia, Dammam University publishes certain journals. I have published there also, and you will be surprised to know that if you multiply this into 300 days and 200 nurses, if you consider are working in this hospital, it runs into $1 million. The losses just by walking to the elevator, it can lead to so much of losses to the hospitals we are not aware of. So, lab and pharmacy on 2nd floor, radiation equipment on ground floor. That is again, why not bring them on the same floor? We also do a spaghetti diagram. Spaghetti diagram means we make a diagram. As a healthcare quality professional, you learn those tools and techniques as well. Like, so how the patients are going. So here, let's say these are the departments, and we see patients coming here. This was the patient flow, which we found. And another patient, this is how they moved. And this is another patient. He also found, let's say, so obviously A and B should be brought close to each other. Like A could be registration desk, B could be billing desk, maybe. Now, so in that case, you should bring them together to reduce the waste in the system. Yeah, so I have spoken about, yeah, maybe 2-3 more minutes on that. Then I will go to the data analytics part. Any interruption is a waste. Any interruption in between is a waste for the patient. Variation, like you'll find typically that when patients are being discharged, they're discharged in the afternoon, and patients are waiting to get admitted in the morning. Many times, private hospitals, they lose their patients because they have not discharged the patients early. We reduce the patient discharge time drastically for many hospitals, and they have really reaped huge benefits out of it. There is another thing which you learn, like visual control, to reduce the errors. I'll not go too much into detail of this. I'll just showing you. So visual controls can help you reduce the errors. There's something called POCA-UK. POCA-UK means mistake proofing. Even by mistake, you cannot commit a mistake. Make your hospital visual hospital. Means people should not waste their time asking for directions. Make it such that people can go wherever they want to go without asking any questions. Then, like a rice cooker, which is an example of mistake proofing or POCA-UK. POCA-UK is a Japanese term which says mistake proofing, which means even by mistake, you cannot commit a mistake. Also known as foolproofing. Foolproofing means even a foolish person cannot commit a mistake. Even you want to commit a mistake, you cannot commit a mistake. Say, for example, I'll give you some examples. The machines cannot be cannot operate beyond the normal safe or maximum levels. Even if you want to operate, they cannot. Okay. Then wrong entry would be prevented. Something which is abnormal will be rejected. That is one example of a POCA-UK. Oxygen and nitrogen cylinders, they cannot be interchanged. They cannot. You cannot fix a nitrogen cylinder into a connection line of oxygen cylinder because the connections are different. So these are all examples of POCA-UK, fixed number of packages during the surgery, complete catheter kits for the insertion, etc., prepackaged medication. These are all examples. So this was the brief knowledge about the lean part, etc. Now let's talk about the data analytics part, which is, of course, so you'll be asked questions about histogram, you'll be asked questions about Pareto chart, you'll be asked questions about cause and effect diagram, you'll be asked questions about, and surprisingly, people find it difficult. They find it very difficult, but they are the easiest questions. In fact, they are the most unambiguous questions. Means if you know about the tool, you can answer within 15 seconds. It's so easy. So we train you for that. Okay, do you agree that there are two types of data? Something can be measured and something cannot be measured. Do you agree with that? Okay, one of the questions are, Sadia is asking, how government is the customer? Very good question. Let me, have you understood this? Have you understood this part before I go to the, yes, you keep answering. Most of the people are telling that they agree. Okay, actually, okay, so I'll give you the answer also. But before that, let me answer a question. Sorry, I saw this question a little late. How government is the customer? I was talking about government could be a customer. Yeah. Okay. For a government hospital, obviously government is the customer. Even the shareholder is your customer. Think of the process of controlling the pandemic. Government wants you to control the pandemic. So you're doing something for vaccination program. You're not doing only for patient. You're doing for the government also. Then government is funding. they're giving you money. Your shareholders are giving you money. They are one of the key customers along with the patients. Not only patients, even your relatives of the patients, they are also your customers. So have you understood this part? Yeah. Have you understood this part? That who's the customer? Okay, please understand who's the customer. To whom the output is going. Yeah. Who is interested in your output? Who is interested in your who the person or any entity which is interested in the success of your output? Isn't the government giving you certain KPIs? Isn't the government giving you certain... See, not only patients are giving you KPIs. See, patient is obviously a customer. They say, let me take an example. Okay. And again, it boils down to the measure. How will I measure? So there are three measures for sure. One is the cycle time taken to complete a job, like waiting time, etc. Then we have got costs. And third is errors. I'm taking some very common measures, right? So if you think of patient as the customer, which everyone is able to foresee that the patient is obviously a customer, everyone agrees to that. Okay. Patient is interested in, like, please, finish off my or whatever, treatment, etc. I don't want to wait. The waiting time should be reduced. Cost should be reduced. Errors should be reduced. Errors. Don't commit a mistake. Yeah. Don't, obviously, no patient would like it. Apart from that, there could be many, like infection rate. Okay. Now think of the COO of the hospital. Think of the shareholder of the hospital. Isn't he telling you, please reduce the waiting time? Isn't he also telling you, please reduce your costs? Isn't he not telling you, please reduce the errors? My brand names are getting affected. My profits are getting affected. Isn't he not telling you that reduce the infection rates? He's also your customers. He's also interested in reducing this. Even the government is also telling you, please reduce your costs, please reduce your errors, please reduce your infection rate. So many things. There could be many KPIs. These are all known as measures. Measures on your products and services, which is, of course, your output. Now you understood. I hope those who are asking, some of you are asking how the government could be the customer, how shareholders of our hospitals could be the customers. Okay. Sometimes government or hospitals are being funded by the government. So that is why they are also your important customers. They're very, very important customers of your hospitals. Okay. Great. Now, going back to our next topic, which I was here. So some of you said, okay, so I'll give you maybe 15 seconds more to answer because I just deviated again. So yeah, so tell me, do you agree with this? Okay, so now let me tell you an interesting thing. As a quality professional, you have to disagree with that. Okay. Everything can be measured. Yeah. Everything can be measured. Okay, so let me tell you how. You'd like to ask me. So there are two rules. You cannot improve if you cannot measure. There is one. And you can measure everything. So yeah, Jazila has written, yes, you can measure quantitatively and qualitatively. Yes, so you can measure everything. Okay, I think some of you misunderstood the question that it is asking. There are two types, cannot be measured and can be measured. So basically, you have to disagree in the sense that everything can be measured. Everything can be, there's nothing which cannot be measured. Now, how to measure everything? Okay, first of all, data, there are different three responses. We do not collect the data. Sometimes they say. Sometimes you say we collect a lot of data, but this is not relevant to the problem you are facing. See, it's like a person searching for a diamond ring in the dark. You ask him what happened. Why you? No, sorry. a person is searching for a diamond ring under a street light, let us say. Yeah. So you ask him, what happened? He said, I've dropped my diamond ring, and he's looking for the diamond ring under the street light. Then you ask him what exactly happened, and he says, I lost my diamond ring somewhere out there, 100 meters away from here, where there's total dark. So you ask him why you are not searching there, where you lost it. So he says that, how can I search? There is darkness. I cannot search in the darkness. So you will tell him that you keep searching for your diamond ring in your street light, but you'll never find it because you have not dropped it there. You dropped it at the dark place. Throw the light at the dark place. Same thing happens in our hospitals. We keep searching for our solutions in the existing data. You say, I have got a lot of data with me. I'm consulting for many hospitals, and they, oh, no, don't worry, Mr. Amitabh, we have got a lot of data. Don't worry. And they show so much of data. But I tell them that, my dear friend, problem is somewhere else. Your data is talking about something else. Did you collect the data? There was discharge time project. Maybe I'll show you. I'll show you an example here. I'll not show the exact, but some imaginary numbers I'll throw and I'll show you. Where is the discharge time data? Where is the related, what are the factors which are influencing the data, your discharge time? Do you have the data related to that? Oh, no, we don't have data. Just collect 30, 40 samples and make conclusion about the large population. So that sampling comes into picture. So there are, some people say, I had too much of data, but I don't know what to do. And some people say analysis is too complicated. Not anymore, my dear friend. Don't say like that in today's world. There are few clicks, everything is possible. You have to just understand. You have to just understand where to click the right button. So the CPHQ gives you the right orientation. It tells you how to analyze anything. So first, let us understand there are two types of data: continuous data and attribute data. Continuous data and attribute data. Okay. Continuous data is something which is continuous in nature, in the sense that, okay. By the way, I have got videos also which are available on our Anexas YouTube channel. You can subscribe to Anexas channel. I'll show you those videos in Arabic and English both. They're all available. So those of you who are interested, in learning, if you are interested in learning about data analysis, etc., feel free to watch this video. They are all free. They're all free, and they are very to the point. We have not spoken too much about anything else. Especially, also, if you want to know about the CPHQ related stuff, that is also there. And the same program, whatever I am doing right now, I keep conducting almost every one month or every 2 months. Once in a while I do that. And you can also tell your friends to attend that. And if you want this video recording of this particular program will be made available to you, you can also circulate it amongst all your friends. I still remember many of our students, they just see, we have trained around 10,000 students. Out of that, 4,000 have appeared for the exam, and 3,700 plus have passed the examination. So we have got a strike rate of around 90%, 95%. At times it becomes 100% for all the batches. Some batches have given us 100%. When I say 100%, means, let's say 30 people are attending the session. Out of that, 15 people appear for the exam, because some people just want knowledge. They don't want to appear for the exam. So those who appear for the exam, out of that, 90% pass the examination. We give you a lot of mock questions. I am reminded of a story of Aisha, who was working as a quality specialist in one of the hospitals, and suddenly she has become over the period of 4-5 years after attending her CPHQ and Lean and Six Sigma Green Belt and Black Belt, she's heading quality in the hospital. And lot of success stories like that we have got. If time permits, towards the end, maybe I'll show you some videos of these people talking about their success stories. But yeah, now coming back to our data related, the importance of data. I'm trying to motivate you. See, these tools and techniques. And in fact, she just attended our CPHQ training. She did a certification. Green belt, black belt certification is because we are the certifying body for that. You can, the certification is assured. We will prepare you well for both CPHQ. If you're interested in certification of green belt and black belt, black belt, we are the certifying body. So the certification is in a way assured. You can appear for exam any number of time. But for CPHQ, it is the exam is conducted by the NHQ, and you have to appear for the examination for that. And we prepare you well for that also. And you have to undergo some mock exams. We provide you with mock exams also. And sometimes some people don't go for mock exams also. Just whatever questions we have done in the class and whatever we have taught in the class, that's good enough. You don't have to study too much. And I'm repeating, although we'll give you some thick books also. Some people are interested in reading the books. If you have time, please read the books. But you don't have to read so many books. Just the training material, whatever we give it to you, we have done a Pareto analysis of it. Like 80% of the question, 80% of the most of the important things we have, which are in the 20% of your total book. See, suppose your book has got 1,000 pages. 200 pages means 20% of the 1,000 book page contains the maximum information. So we know which are these 200 questions because we have been analyzing the exams, CPHQ exams over the last 12 to 13 years. So we know and we give those questions, and also our training material is tailor-made for just passing the examination and also empowering you with the tools and techniques. Okay. So this was just an answer to the question. Some of the people were telling that. So one of you are telling, Asi is telling, sometimes cannot be measured. Now let us see. Okay. Oh, sorry. I was actually taking some time out to talk about the video. Let me show you the video also. Sometimes, yeah. So this is, I will just play the video for 30 seconds just to tell you these videos do exist. You can always, and these videos are available in both English and Arabic and Hindi as well, those who are interested. And let me talk about, okay. Just a demonstration. See, that's a good material on our website. If you go for it, you'll find. During COVID times, I used my time to, prepare all those videos because there were no classes. So there are no sessions. I've been doing, by the way, I forgot to tell you about myself. I've been conducting training programs for the last, so I've got total 35 years of industry experience, and 25 years has been only conducting quality related training programs. My career is devoted to that, and I enjoy doing that. And
Can have a decimal place.
Especially, for the hospitals. So if you are interested, you can always invite me to conduct training programs for your hospitals, and for that you can contact an Anexas team for that. Okay, so I was talking.
There are two types of data: continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit. Say, for example, age, height. Age is 52.5 years. That's my age. Height, maybe 180.1 centimeters. Cycle time of a process, 3.5 hours. Or procurement time in an organization, 120.3 days. These are all continuous data because they all have a possibility of a decimal, means they can be expressed in decimal points, and also they all have a unit.
So I hope you understood this part, that every time you have a unit, yeah, these are tricks to remember. And these are just some tricks to remember that you have a unit and a possibility of a decimal point, because it can be represented on a number line, which is -infinity to +infinity. What is the number line? Any number. I can put 180.1 on this. Yes, 180.1. Yeah. It's a continuous data. Why it is known as continuous or variable data? Because it can be, expressed on a continuous line. That is why. Now let us look at attribute data. So if I ask someone, and it's the same thing I was telling, right? That you can see this in Arabic as well.
I'll have a possibility of a decimal.
Sorry, just a minute. Let me show you the Arabic video also. This is just for demonstration I'm telling you so that you can watch. FMEA, please watch for sure. I've given you the FMEA. So I have, okay. So this part is done, right? This part is done.
بيانات مستمرة لأنها جميعها لديها إمكانية وجود رقم عشري، مما يعني أنه يمكن التعبير عنها بالنقاط العشرية وأيضا.
Now, let me ask you, can you tell me any one thing which you cannot measure? Just tell me. So I'll tell you how to measure. I'm giving you a trick. Just tell me anything which you cannot measure. People are taking emotions, happiness, right, satisfaction, okay. Okay, let me take an example of attitude of the person. Yeah, okay. So these are some examples. So whatever you want to measure, so I'll give you a trick.
تحتوي جميعها على وحدة. الآن دعونا نتحدث عن بيانات السمة. يمكن التعبير عن بيانات السمة في فئات ويمكن حساب الفئات. قل على سبيل المثال إذا كنت تريد قياس السعادة. لذا فإن أسهل طريقة لقياس أي بيانات سمة هي إنشاء.
So what I'm trying to say here is, whatever you want to improve, you can just write. Whatever you want to improve, you can just write here as an attribute, like satisfaction, emotions, and then create a category out of it. Create a category out of it. See, if you can't think of a category, presence or absence of that particular data, that attribute is a category. Like, for example, satisfaction, I can say satisfied, dissatisfied. One more thing, attitude. Attitude is good attitude, bad attitude, helpful attitude, unhelpful attitude. So create a category. Happiness, one of you said happiness. Happiness. I'll give an example of happiness as well.
فئة. وإذا كان ذلك ممكنا، يمكنك إنشاء فئة ثنائية. يمكن أن يكون وجود أو غياب تلك السمة من أبسط الفئات. لذا، إذا أخذت السعادة كمثال، هناك فئتان يستطيع خلقهما، سعيدة وغير سعيدة. لذا، إذا
So what I'm doing here is I'm creating two categories, happy and unhappy. Now I can count how many people are happy. So, you can do that.
إذا كنت أرغب في زيادة سعادة الموظفين في المنظمة، فيمكنني دائما حساب عدد الموظفين السعداء. لنفترض أن 60 موظفا سعداء و40 موظفا غير سعداء. يمكنني التعبير عن هذا كنسبة. وهذا يعني أن نسبة الموظفين السعداء في مؤسستي هي النقطة السادسة ونسبة الموظفين غير السعداء هي النقطة الرابعة. ويمكن أيضا التعبير عنها كنسبة مئوية. الآن
Okay, so fine. So I'll just translate it for you in English, and I just wanted to demonstrate all our videos, lots of videos, all tools and techniques available in English and Arabic on our Anexas channel. Please subscribe it, and you will really get a wealth of information. Wealth, even though you don't want to appear for any examination, but it's a very, very useful information for you, and it is tailor-made for all healthcare systems. So you will really find it beneficial. And I hope everyone has noted down the FMEA. I'm repeating, FMEA is like a very, very powerful tool. I want you to apply that and surprise your bosses. You want to reduce the patient fall, just you get your solutions in the FMEA. I've given some examples, some simple examples there, so you can use them there. Okay, now I hope you have understood how. So I want to improve the happiness in my I want to increase the happiness index of my nurses. Yeah. So I found that 60 nurses are happy, 40 nurses are not happy. So percentage happiness is right now say 60%, right? I want to increase 60% to 80% happiness. I can do a project. So how can I improve anything? How can I improve anything? By doing project. So before I proceed to the project, I want to have a quick check. Have you understood there are two types of data, continuous data and attribute data? Everything in the world can be definitely measured as attribute data or qualitative data, also called as qualitative data. Okay. Thank you. So some of you were telling earlier that I can't measure a lot of things. Now they're telling yes. So nice of you. Now I'll tell you the trick. I have told you the trick. Tomorrow your boss asks you make a KPI. You can easily create a KPI. First you create categories, and then infection rate. It's attribute data. Infected, not infected. That anything which is percentage is an attribute data. Okay. Please remember, anything which is percentage is not continuous data. It is attribute data. Okay. Like I'll tell this exam question. No? Let me first explain. Huh? Okay. First I'll explain, then I'll ask you the question. There are two nurses A and nurses B. Nurse A and nurse B. Nurse A, let us say, they are, they're into vaccination. They're giving vaccination to the patients. And let us say every week, 10 patients complain that, I had a pain after, administered the vaccine was administered. And in B, 20 patients every week, I'm taking an example, every week 20 patients complain for B. Who is better? Who's better? Most of the people, they're telling that yeah, A is better. Okay. But be careful. Most of the bosses will also say, yes, yeah, A is better, less complaints. But please remember, complaints, errors, defects, they are all attribute data. What about no complaints? There are two categories, right? I was giving you information about only one category of attribute data. So you should ask, okay, customer complaints is attribute data. What about the no complaints? Tell me about the other category. And I give you another category. So nurse vaccinated, B vaccinated 200 patients and 20 complaints. Nurse A vaccinated 100 patients and 10 complaints. So what is proportion? 0.1 or percentage, also you can say percentage, 10% in both the cases. So both nurses are same. If you had given 200 nurses to nurse A, so 200 patients to nurse A, she would have got 20 complaints. Okay. So please understand the example, attribute data. And this is the questions, sometimes patient satisfaction index or percentage of satisfied patients. That is continuous data or attribute data. The answer is, it is attribute data or qualitative data. Okay. I hope any questions, any difference of opinions, please feel free to ask. Okay, now up to here you are okay. Can we okay, I'll just show you some simple projects. PDSA project, DMAC project, they're all, there are systematic approaches of doing improvements in our hospitals. You see, what is a project? What is a project? Okay, so let us learn about the difference between process and project. Let us understand that first. Yeah. So let us go. See, everything boils down to systemic thinking. If you don't think about your system, and nothing can work out. You cannot improve your hospital or your processes. Okay, so now let us go to the system. And I'll remove some of the unnecessary things now here. Okay, fine. So anything which is repetitive in nature is known as process. Process means like every day you're taking, like patient treatment is a process, right? Patient treatment is a process. Reporting the KPIs to the government is a process. Vaccination is a process. You are doing it again and again. You are following the same steps again and again and again and again, continuously over the period of time. That is known as a process. What is a project? Project is one-time endeavor. It happens only once in the history of the world. Like constructing the pyramids, that was a project. Constructing Taj Mahal, that was a project. Installing a new robotic surgery machine is a project. That's one time. Similarly, certified quality professional takes up improvement projects. They develop the skill of doing a project so that they can improve their processes. How would you do that? Identifying where you are not performing well. Say your waiting time, KPIs, it should be less than 10 minutes, and your waiting time is 20 minutes. You take up an improvement project. Yeah, Amarjit is telling, yeah, learning a new skill is a project. Yes, you're right. Learning what you are doing here, learning CPHQ is a project. Yeah. Okay, great. And cost. If your costs are high, you'd like to reduce. So you take up improvement projects. Today, my waiting time is 20 minutes. I want to reduce it to 10 minutes. This is a project. And when you are doing a project, you follow PDCA or DMAC. There are various methodologies. I'll not go into the details of those, but I'll just tell you basic 4, 5. First, you make a team. Whenever you want to do an improvement project, you create a team, right? Very briefly, I'll take you through 1 or 2 projects. And then I will take you, if still time is there, I will show some advanced tools, advanced how they're done, how you typically do a project, how a typical certified professional will do a project. I'll show you. You don't have to really bother too much about the very details of these techniques, which I'm going to demonstrate, because the idea is to make you familiar with this. Right now you're not. I'm not skilling you fully. Means the idea is that giving you the awareness. So please understand from that perspective. You should just get a simple awareness. That's good enough for today's session. So because you are getting introduced to a particular concept. So you make first you write a problem statement that this was our waiting time. This was our waiting time. Okay. Let's say here it's around 90 minutes was the waiting time. You would like to reduce it to 30 minutes, by 30 minutes. Now, typically what you do, you first start with the SIPOC. Now, what is the SIPOC? Again, taking you back to our, see, every time. Choose supplier, S supplier, I inputs, P process, output, O and C customers. SIPOC. SIPO and C. SIPOC. To have a systemic thinking. Because the problems are in the process. They are not in the people. See, your waiting time is high, not because your people are lazy. It is somewhere related to the process. Your errors are high, not because your people are not good or they want to commit mistake. No employee wants to commit a mistake. You know, like think of a hospital, where you have got, let's say, 200 employees. They don't have a target that today we'll commit 50 mistakes. But by the end of the day, they commit 50 mistakes. Typically 50 plus minus 10, that's how the whole system is. What does it mean? It just means the problems are in the process. People are not there to commit any mistake. Change the process and the same people will not commit any mistake. Yeah. So that is why we call it a systemic thinking. Blame the system, blame the process, not the person, not the individual. And for that, you have to measure not only output. See, what I wrote down here was output measures. Outcomes, we call it outcomes. Outcome measures. We also have to have process measure. We also have input measures. Input measure, process measures. Yeah. To have this perspective, usually you draw a SIPOC. Yeah, this program is being recorded, so you can always watch the recording any number of times later on. So even if you're not making notes, that's fine. You can watch it again. Yeah, so your patient, if I'm talking about waiting time, so outputs, basic process. So output measure would be waiting time. Process measure would be time taken to register, time taken to consult the doctor, time taken to receive the medicine. These are all our process measures. An input measure means availability of patient history, yes or no. Registration forms are available, or yes or no. These are all attribute data. Doctors available, yes, no. Receptionist skilled, yes, no. Bills done in time, no, yes, no. Software is working, not working. These are all input measures, either expressed as continuous data or attribute data. Yeah. So we have outcome measures, process measure, input measure. Now, outcome measure is what we are trying to improve, but it is dependent on the process and input measures. So the first thing what we do is in the data analysis, we collect the data. We learn a lot of sampling techniques in our CPHQ exam, preparation exam training program. For the time being, just understand that we can use a proper sampling technique, let's say random sampling, and we make a histogram. You see, most of the repetitive processes, they will follow a distribution like this. We call it as normal distribution. You'll find that most of the times, our process is centered around a particular value. And as you go away from that particular center, the number of incidents, number of frequency, the number of times you observe, that particular number reduces. Like for example, here, our waiting time is 92. But there is a average, and then there is something called standard deviation also. Right now, I'll not talk too much about standard deviation, but if you're interested in learning about standard deviation, I'll give you a link. You can always watch that. I have explained the formula. I have explained the derivation of the, that thing also. But for the time being, let's understand that you will not be asked to calculate standard deviation in the exam. Okay, you should know the application of it. You're not expected to do these charts. No one will ask you to make the chart, but you should be able to understand what type of chart is this. This is known as histogram. Historical graph. Historically, I'm presenting your project, your process to you. It means historically, I collected some data of some waiting time, and this is how the last month process looked like. This is how my process was looking like. Average, a little bit of here and there. It is telling you how I'm performing today. Okay, so this is how you collect the data. Then after that, You find why I'm performing like that. You do a fishbone diagram, also known as Ishikawa diagram, also known as cause and effect diagram. Why I'm performing like that? There are lots of causes, lots of things, but only 20%, 80-20 rule. Remember, 80% of my problem is due to 20%, only two causes. This could be whatever. Less doctors, could be less pharmacists, whatever. Only 2-3 causes are responsible for 80% of my waiting time. You identify that. You make a chart. Very easily, in one click, you can make a Pareto chart. I will show you in a short while how to do that. You identify these are my two registration time is more and doctor availability is another. These are the two root causes. Forget about other causes. Not required. And then you attack those root causes. Only two root causes, get the solution and reduce your waiting time. Very simple. Root cause based approach. Let me show you one more patient waiting time which we did for one hospital. This was the data which we collected. Patient discharge time. This was patient discharge time, discharging a patient. This was the patient discharge time. Data was collected. Some few samples, 30 samples is good enough. Don't have to collect too many samples. We'll tell you the logic also why 30 samples is good. 30 is good sample size for continuous data. 200 is a good sample size for attribute data. Actually, 1100 is the ideal size for attribute data, but 200, 300 is very good sample size. And the continuous data, even 30, 40 is good enough. 30, 40 is good enough. Don't worry too much about so many samples. No. Like, for example, we collected some few samples. Even if you collect more samples, it will just fill in the, it will make your curve more smooth. It will make your curve smoother. Why you want to waste time in making your curve smoother? You're not going to get any additional information. Okay. Okay. So please make the histogram that tells you average and then standard deviation. Okay. So then, okay, we also make a, now we will look at this. What is causing this problem? Patient discharge time high. You brainstorm, get the people together. You apply some brainstorming techniques. There are certain rules of brainstorming. Apply those rules of brainstorming. I'll show you some of the rules, important rules of brainstorming. So whenever
Brainstorming is a method.
Brainstorming is a very, very important tool for a quality professional. So when you're doing a brainstorming means you're trying to generate ideas. Okay. So some of the rules which you follow that.
As I told you, that brainstorming is used for either generating the possible root causes or getting the ideas to solve the problems. There are certain rules which need to be followed in brainstorming. The rules of brainstorming are: give equal opportunity to everyone who is participating. So tell them to participate, and you can use different techniques. As I told you, we will be learning in the improve phase. Capture all the ideas, so document all the ideas. Whatever is being discussed, whatever ideas the participants are given, someone should be there to document, or a scribe you can appoint to document all the ideas. Leave your designation and ego along with your shoes outside the meeting room. That means don't think that if you are senior, your idea carries more weightage. So obviously this ground rule should be very clear to everyone, and everyone should be encouraged to give an idea, and everyone's idea should carry equal weightage. There should be a non-threatening environment. When people are giving ideas, they should not be afraid of giving ideas. So you should create an environment where people should be encouraged to give the ideas. Also, we should ensure that wherever the brainstorming is taking place, there should not be any disturbance, so people are focused on brainstorming. Sometimes people might deviate from the topics. There is a tendency that some important issue crops up during the discussion. So at that time, you can always create a parking lot saying that, well, this idea or this issue is very, very important and we can park it to be discussed after a while once we complete the brainstorming on this particular topic. We should encourage people to fantasize freely. We should not put brakes on our thoughts. So you can give some out-of-the-box ideas, you can give some wild ideas, and if people are giving you wild ideas, they should be encouraged. If you give a specific duration of brainstorming, we should try to complete the brainstorming within the time duration and defer evaluation. Now, this is one of the rules which is often violated. People start discussing the ideas. Someone gives an idea and someone else says, well, it will not work in an organization. Or some other person gives an idea and someone else comments that, wow, it's a great idea. So don't evaluate. Reserve your comments for evaluation at a later stage. When you are generating the idea, when you are generating the root causes, they are not to be evaluated. You cannot say that it is a good idea or this is a very good root cause which you have thought of. No evaluation, just write down whatever is being suggested. Generate quantity, do not worry about the quality at the initial stages. So you have to generate lots of root causes, lots of solutions, more the better. A pearl diver, he dives into the sea to find the pearls. If he just collects 10 oysters, the probability of getting the pearl is very low. But if he collects thousands of oysters, the probability of getting the pearl is very high. So similarly, if you want to collect great ideas, some of the out-of-the-box ideas, some creative ideas, then definitely you should create more and more ideas. So how to generate those ideas? There are different techniques. Some of these techniques we'll be discussing in our improve phase. But right now,
Yeah, so I think you got idea of generating the brainstorming. Now, brainstorming should be done only on the root causes. Now, whatever you find most occurring causes, the Pareto analysis will tell you which are the top 2-3 causes. Just focus on those top 2-3 causes. It really makes the difference. So that's how typically you do any project, and that's what I was talking about. And these tools like Pareto analysis, histogram, etc. And I teach you lots of other tools also, advanced tools as well, which will help you to pass the examination. And because of so much less time, I did not, go into the details of see all the all the tools and techniques. But I hope you got an idea what exactly we do when we are trying to improve any process. What are the things we have to utilize? What is the approach? It's a structured approach. A quality professional will always have a structured approach towards solving the problem. So if you are interested in attending our training program, feel free to connect with us. I'll be happy, in fact, to train you as a CPHQ professional. And my team will, will give you the detailed dates also. These are the dates.